advantage of No Child Left Behind, but our scores continue to go up. But what it does, it demands some accountability. Some accountability on how our dollars are spent in education. To make sure that when our kids graduate high school, they can at least read and have an acceptable degree so they can go on to school. That's what No Child Left Behind was about. It gave parents choices. It gives schools and states choices on how best to measure the responsibility and the accountability of our education system. That's all it was. And we could devise any plan in any state to make it fit. And we did that. Montana was a little slow on theirs, and therefore sort of got in jeopardy of getting some federal funds because they didn't have a right plan in the right place. But nonetheless, yes. What's wrong with demanding accountability in anything, and especially our education system?
We have accountability in public education. It's called your local school board. If you have a problem, they're easy to find. They're your neighbors. No Child Left Behind does not work. It might work well in Detroit or Omaha or Washington, D.C., but it doesn't work well here. There's a couple reasons why I don't like it, and there's a couple reasons why I think it should be repealed. It takes power from the local school board and sends it to Washington, D.C. It doesn't even stop at the state, and I don't like it when the state takes away power from local school boards. Local school boards know how best to educate their kids. We're sending power to Washington, D.C. The other issue is it's made teachers accountable, all right, for parents getting their kids to school. That's not fair. We've got rural schools in this state right now that can't get certified teachers in the classroom. They get marked down for it because of Nickelby, No Child Left Behind. This does not work for Montana, Senator Burns, and if you were here, you would know that.
Senator Burns.
Well, this is not what I'm being told by principals in middle schools. I visit a lot of middle schools. I visit a lot of principals and a lot of superintendents. And they also tell us we need to fix these things and these scores and little things like that. And you know what? We're fixing them. We're fixing them. And that's what it's all about. But there's some folks that don't want to be accountable. We want some accountability. That's all we want, is our dollars doing what they're supposed to do in order serving our kids. You know, I'll make another comment a little bit later on. But it seems like that the Montana could have devised any plan they wanted, anything they wanted, and still have some accountability in their education system.
We've, with No Child Left Behind, we've made teachers into bureaucrats, teaching to standards instead of teaching kids how to think. I served on a local school board in Big Sandy for 9 years, 5 as chairman. And I can tell you that we were under the microscope. When we did something, parents were there, they were concerned about it. It wasn't just about the football and basketball program either. It was about things like English and science and social studies and shop class. The truth is that this takes education in the wrong direction. You have accountability, and it's accountability that's real and accurate and not frustrating, and allows teachers to do their jobs. Keep the power with the local communities, your local school board.
Okay, Mr. Tester, you'll be next to answer this question, which really does reflect our dynamic scientific community in Ravalli County, including a federal biological research facility here in Hamilton. Do you support stem cell research? Please elaborate.
I do support stem cell research. I think it gives opportunity and hope for people who most need it, whether it's Alzheimer's or multiple sclerosis or go down the list. I think that we have opportunity in this country to help those people in a way that they've never been helped up to now. And I support stem cell research, and that's as clear as it is. I think it helps people, and anytime you can help people, particularly those people that need hope, that need the ability to know that there's people working on it that they may be able to get better. I think it's critically important, and for those reasons I support it.
I support it too. Stem cell research. You got a great laboratory. You got Rocky Mountain Labs out here who continue to offer opportunities for in the biosciences out here for a long time. I really support adult stem cell because we're finding results there. Embryo stem cell has its limitations. For 25 years, that research has continued. We've gotten almost nowhere with that. But nonetheless, it continues in the private sector. I don't believe we should use federal dollars in embryo stem cell. But umbilical blood offers a great future, and adult stem cells. And we continue to see results there, and should commit our federal dollars to the places that we're finding the most results and some real promising things happening in stem cell research. So I support it.
Thank you, and I agree.
Okay. I think we'll have time for one more question here today. So next on the list, and that would be Senator Burns, you're first to respond. Because of budget constraints, Veterans Affairs plans to lay off its representatives at nation's unemployment offices. And with a 17% unemployment rate among returning Iraqi war veterans, how can that be justified?
Number one, we have increased the VA budget and appropriations 51% since 2001. Last year, I passed the biggest increase in veteran spending on my interior bill, $1.7 billion. It was under my tutelage that we got outpatient clinics across 7 of them across the state of Montana. Fort Harrison now is the #1 hospital in the veterans for services and the way we handle our veterans here in the state of Montana. Now, we also passed a little bill the other day that lets our training, our people coming back from Iraq or coming out of the service now for training. We've increased that even down to the level of what the jobs available in their neighborhood are. We did this with the National Trucking Association, American Trucking Association, because they're having a hard time finding truck drivers. And so we'll train. We continue to train and offer the money, but we're spending more money in the veterans right now in their health care system than any time in the history of this country. And I just want to bring up a couple of things. The advancement we've made in the medical field in order to take care of our veterans coming back has probably seen the greatest surge we've ever seen. And that took dollars to do it. So it's not cutbacks that maybe some people are making in some states are making those decisions, but the money going to the Veterans Administration is as high now as it's ever been. Just like I said, I passed that at $1.7 billion with a B on my bill last year for the veteran. I'm a Marine, former Marine. And I will tell you, I'm going to fight for my veterans at every corner and make sure they're taken care of.
Thank you.
We are in a situation right now with what's going on in Iraq where we've got a lot of folks coming back that are injured, around 20,000 on the last count. And our medical profession has done a great job because a lot of these folks wouldn't have survived a previous war. It's going to take a lot more resources. It's one of the costs of the war in Iraq, and it's a cost that we should bear first. When these soldiers come back, they need to be assured that they will have the benefits and not have bureaucratic timelines that might prevent them from getting the benefits. It's critically important. It is critically important when they signed up and went over wherever they may be, Iraq, Afghanistan, and put their lives on the line. They need to be assured that when they get back, they're going to be the agreements that we made are lived up to in benefits and health care. I just think that there are a lot of people, when I go around this state and visit with, that are having a hard time getting their care. I talked to a young man in Missoula. It's been about 8 months ago. The gentleman was 22, 23 years old.